Hi everyone, Dr. Jeff back with this week. It's glad to be back. And of course we've got Hannah with us now. She'll be with us the next few months to help us out at the office here. And I know this week we've got an interesting topic, which is...
Yeah, so today we'll be talking about acute versus chronic inflammation. Acute inflammation occurs when you may have had a sprain, like in your ankle, in your wrist, and the body's natural response is to cause inflammation just to prevent that joint from moving and so that your tissues can heal. What's chronic inflammation, Dr. Jeff?
So chronic inflammation is something very few people talk about.
Yeah.
You probably never heard about it. It's something where the inflammation lasts a long time, or it's in the body and it's more destructive. What we talked about acute inflammation is restorative, so the body is trying to rebuild and return the joint to its proper motion, whereas chronic is more destructive. So this is something we're looking at: rheumatoid arthritis, lupus, irritable bowel syndrome, these things that are more autoimmune disorders, and they can create inflammation that's more destructive in nature. And again, smoking, toxins, if you drink 3 pops a day, this all can lead to some types of inflammation. And a lot of people have chronic inflammation, they don't even know if they have it.
Yeah. So some ways you can help with acute inflammation is by following the RICE principle. So this is rest, ice, compression, and elevation. This just helps kind of speed up that process, especially if you're in a lot of pain. This can help kind of dull that pain. How would you go about healing chronic inflammation?
Well, one thing we have to figure out if you have chronic inflammation, which majority of people do, there are some types of blood work we can do to try and determine if you've got some chronic inflammation going on. Whether it's sedimentation rate, whether it's some sort of protein, things we're looking at in your blood. That's something your doctor can order for you. A lot of times we go by more your symptoms. So a lot of people with chronic inflammation they're gonna be tired. They're not going to sleep well. A lot of people will have rough skin because the toxins trying to get out through their skin. The toxins may try and get out through their ears, so they have lots of wax. They may try and get out through their sinuses. They got a runny nose all the time. But generally we'll find with these people that we have to kind of determine if they have it first, which can be a little challenging. But once we do figure out that you may be suffering from chronic inflammation, if it's really bad, your doctor may prescribe you a steroid of some sort to help with that inflammation. Again, chronic inflammation is very destructive in nature, so we don't want to have to deal with it. But a lot of times with chronic inflammation, we kind of have to deal with it through your diet and with your lifestyle change. So somebody who smokes, you may want to stop smoking. If somebody who drinks 3 or 4 pops a day, you may want to stop drinking all that pop in it. So a lot of times a naturopath is someone who really helps with this. So we're going to see them. So generally, a lot of times they'll put you on a cleansing diet of some sort. And usually this means getting rid of dairy, getting rid of sugars, kind of cleaning your diet up with lots of water to cleanse you out. So that's one way they can kind of deal with it. So other ways is exercise. Exercise is always good. So they say get out for a walk, get some nature. But again, we're dealing a lot of times with more destructive types of things like irritable bowel, types of arthritis, lupus, things like that. And again, we actually, because of our lifestyle, we can cause our own inflammation due to smoking and what we eat and drink and stuff. But yeah, so we have to find it first, and then we have to look at where we can clean up our lifestyle to try and help with our inflammation.
Mm-hmm. What modalities would you say that we have in the clinic that you can use to help with the inflammation?
Well, chronic inflammation, depending on where it is, there's not a lot we might be able to do with it. But for acute inflammation, again, acute inflammation is good because it's a reparative type of inflammation, not destructive like chronic. But you don't want to have it there too long, because if you have it there too long, it can turn into a chronic type of inflammation. So after the first few days, we really want to get at it. We can do some muscle stim, which is kind of like we use the muscle to try and pump the swelling out. We use laser. Laser kind of goes in and helps the cells create more ATP, more energy to help heal themselves up. And once we can kind of get between you doing your icing and your contrast bath, which is an ice-heat combination to pump the swelling out. Once we get the swelling out, we get to the range of motion back. Then we can start talking about, we might have to do some adjustments, especially if that's that ankle or the wrist, because if you did enough to sprain it, you probably did enough to pull a bone out. So we have to fix that. And then we can start talking about exercises and rehab. in order to get the strength and mobility back in that joint. When it comes to chronic, there's not a lot of modalities here we can usually do to help with the chronic. That is more, again, lifestyle changes and diet and things like that to really help cleanse the body out and help with that inflammation.
Yeah. Okay, well, if you have any questions or any suggestions for future videos, make sure you send us a message. Share this video with your friends, like, subscribe, and here at Goldsworthy Wellness,
We got your back.